Welcome back to Healthy Talk, empowering your wellness one conversation at a time. I'm your host, Rachel Mann, and today we're exploring a topic that affects millions of Americans, chronic pain, and how personalized, innovative care is making a difference right here in our own community. Joining me today is Chris Hanson, CRNA, ARNP, NSPMC, and MSN with Mid-Iowa Anesthesia and Pain Services. Chris brings a wealth of knowledge and compassion to the field of pain management, and we are excited to have him here today. Welcome, Chris.
Thank you, Rachel.
So let's start by getting to know you a bit. Could you share your journey into the field of pain management and what led you to become a part of Mid-Iowa Anesthesia and Pain Services?
When I started out my training, I started out as a CRNA, and my first practice was at North Kansas City Hospital. And I also did some medical mission work. And it was at that point, after having done a couple of mission trips, I realized that's something God had kind of put on my heart that I wanted to do more of. And so started looking around for more opportunities to get more freedom to be able to do more medical mission work. Went to Marshalltown, Iowa first back in 2009. Worked there for a short period of time. Unfortunately, we had some issues within the anesthesia department. I'd gotten some initial training on performance of epidural steroid injections under fluoroscopy. However, an opportunity became available at Boone County Hospital, which I took advantage of and moved our family a second time to Boone in 2010, and really have been very happy working in Boone since. I started doing initially just epidural steroid injections under fluoroscopy. Came to realize there's more to pain management than just putting a needle somewhere. There is a very wide breadth and depth of knowledge that you have to have in order to try and work on some of the goals that we have when doing pain management. We work on functionality within cases that are presented to us or within patients that are presented to us, and we try and be very holistic in how we evaluate them and treat them. So that does not always require an injection, does not always require giving a pill, but it does require a pretty significant amount of training. It was at that point in 2012 that I came to realize I need to attend a fellowship. So I went through a fellowship through Hamline University for CRNAs to do non-surgical pain management and got great education in that regard, and completed my fellowship in 2014. And at that point I was getting so busy within clinic, I had to make the leap with my wife's blessing and kind of push, because it was for me kind of scary. Ultimately, the whole reason I was doing some of this chronic pain management work was because in these smaller communities, there's a need for that. People don't like traveling to Des Moines. Right. They don't like traveling to Iowa City to get treatment. And we can offer a pretty robust service line here in these small communities. So really, that's kind of where my heart was at from more of a service standpoint. Mm-hmm. And so I made the leap into non-surgical pain management full-time. I actually had a couple of facilities that reached out to me, and it's been interesting under the context that providers talk to providers, administrators talk to administrators, and so really just quietly by word of mouth, my business has grown. Pre-COVID, we were covering a pretty significant area, but with COVID, a lot of pain work that we do was considered to be elective cases, so we had to really kind of tighten down on the amount of work that we were doing. So we contracted a little bit. Here at Boone County Hospital, myself and Damien Basande both perform pain management services here. Damien's a fellow that was with me from TCU's pain management fellowship program. One of the other hats that I wear is I'm adjunct clinical faculty for TCU. That being said, that's been a great relationship, and we have been able to be an educator in addition to a caregiver. That has been fortunate because as I've evolved in this practice, I've come to realize there are not many people that have the breadth of knowledge that they should have to do this job well, and it speaks to the importance of having education in order to perform your job well.
Pain management can mean a lot of different things to different people. For listeners who might be unfamiliar, how would you explain what pain management entails and the types of conditions that you typically treat?
Number one, pain management, you have to play a couple of roles. One role is from a diagnostic standpoint that requires going over a pretty significant history, doing a full, complete assessment of a patient to determine what their symptoms could be. Mm-hmm. And sometimes we're almost like a Sherlock Holmes kind of
Dr. House.
Trying to wade through these things. Because I think ultimately at the end of the day, most people want to know, why do I have these symptoms that I'm coming to you to see why are they there? But number two, we work on functionality. We know that as we age, our body undergoes changes. Mm-hmm. Unfortunately, we degenerate as we age. We don't.
Unfortunately, nobody's found that fountain of youth yet.
Fountain of youth, exactly. Yeah, our joints don't improve, our spines don't improve, but we try and work on a lot of wellness. So we do a complete assessment, even from looking at not even just injective or medicative components, but working on physical modalities of treatment, trying to treat deconditioning that has occurred as well. That can lead to painful issues or even poor nutritional intake. A lot of people have, the Iowa diet that they consume.
Sure.
And so unfortunately, that does leave us at a deficiency of several important vitamins and minerals. There's a variety of orthopedic issues that can manifest as certain types of symptoms. And sometimes people need to have diagnostic imaging performed, and we need to do more thorough investigation. And some of this just takes time, actually sitting down with a patient. We try and do a really good job of making sure that we're very thorough in our interactions with people.
Every patient is obviously very different. How do you approach creating treatment plans that can be tailored for individuals?
We identify potential pain generators and greatest contributor to their pain generator, and we set goals. A reasonable goal could be a 50% improvement in pain severity on the numeric scale, which I hate that numeric scale. Everybody does. It tends to be very confusing, but we have to start somewhere.
Sure.
We also use different disability indices, trying to find activity tolerance, etc. Then we come up with an individualized plan based off of where we are baseline with those patients and try and set steps that we can go through to try and attain a reasonable goal. And we try and mutually set that goal with these patients as well.
I would imagine that there's lots of misconceptions about pain management.
Oh, goodness.
Can of worms?
Yeah.
What are some of the most common ones?
First misconception. Oh, you just want to put a needle in me. That's not necessarily the case. It's a tool that we have in our toolbox, but we have a variety of other tools available to us. Other misconceptions are, oh, I'm going to a pain clinic, so I'm going to have just opioid management. We actually focus on trying to use non-opioid interventions first. And I feel like we do a pretty darn good job of treating the pain appropriately for how it needs to be treated. There's been this kind of pendulum that has swung within healthcare. Some of it, I think, was driven by pharmaceutical companies, some of it driven by maybe not best practices by some providers. And so you have this pendulum where people were getting way too much opioid. And then we also have concerns about, oh gosh, accidental overdose. Well, what plays a role in that? We're finding more and more that it's multifactorial, right? So now the pendulum's kind of swung back the other way, and we're really trying to focus on limiting the amount of opioids. And especially as research comes out and research shows that there are some alternatives that are actually more optimal, less side effects, less risk associated with it, less addictive component associated with it. And really, ultimately, at the end of the day, if it's a nerve pain, you should be on a neuropathic agent. If it's a vascular issue that just was misdiagnosed, you need to be able to assess and find those things out. End of the day, pain management, it's this weird mashup of neurology, psychology, psychiatry, primary care, orthopedics, and anesthesia all rolled into one, and then also personal trainer at times too.
Let's talk about some treatments. What are some of the techniques or procedures that you use to help patients manage their pain?
I would say we have a symbiotic relationship with physical therapy. Physical modalities of treatment are effective for some kinds of pain, not all kinds of pain, but some kinds of pain. And also trying to empower with education to patients the why we do what we do. Oftentimes people kind of poo-poo physical therapy, but at the end of the day, there's definite role for them to play in outcomes. Additionally, we have this symbiotic relationship with orthopedic surgery here. We have some great orthopedic surgeons here at Boone County Hospital through Capital Ortho. And I would also say too that we have great relationships with ortho spine surgeons, several of them here in the state of Iowa. Ultimately, at the end of the day, technique-wise, we do a variety of injective therapies. We have them kind of listed out on our website too. Yes, we can do epidural steroid injections. Yes, we can do radiofrequency ablations. Yes, we can do trigger points. A monkey could put the needle where it needs to go. Jokingly, by the way, I don't want monkeys doing that. That would be bad. The reality is that it's more than just putting a needle where it needs to go. It's also trying to work on coming up with a holistic plan of care for a patient and getting buy-in, which requires education. education too. So many people, I go through their MRIs with them and they have never had somebody sit down, go through the imaging and say, this is what this is what this is. I feel like education is empowering. And if you know what is going on with you, that gives you at least another tool in the toolbox to say, you know what, I can do something about this. And really having a sense of hope, because if you don't have hope, then I'm not going to be able to do anything to help you. And I'm not saying that you need to be a Baptist or a Methodist. I'm saying that you need to find something that makes you wake up in the morning, that pushes you to live life. You need to have socialization. The traditional medical model for pain management is the biopsychosocial model, not just looking biologically at, is this joint bad or is this disc bad, but also looking, are there issues going on psychologically that need to be dealt with? And then socialization, social model as well. No man is an island unto himself, as John Donne said.
How have you seen the field evolve, and what innovations have you brought into your practice?
Initially, when I first started in my training, I feel a much greater emphasis on doing injective therapies. Now I think we've come full circle, and instead of saying, oh, let's just do an injection for this or an injection for that, we're now focusing on trying to improve functionality overall. In addition to that, as far as services that have really been evolving, some of those services we don't offer here at Boone County Hospital. However, we do have referral providers that we can send off to. So say, for instance, they have some minimally invasive procedures, like a mild procedure for spinal stenosis that can be done where they take away some of the ligamentum flavum, not to get too big words or anything, but it's minimally invasive. So it's not like a traditional laminectomy or a traditional fusion. And instead, trying to create just a little bit more space for spinal cord nerve roots. There's other procedures as well that are something we can refer people to. A couple of years into my practice, I really came to realize needed to do some more things for migraine treatment. So I've incorporated doing Botox for migraines, and I can reference some cases where I had a patient that was sent to me for spasticity in his legs. He had a closed head injury and had been in a nursing home for well over a year, and it was to a point where he had contractures of his legs, and those can be painful. He could not extend his knees greater than 90 degrees, so he couldn't stand. And through a series of Botox injections under ultrasound and incorporation of physical therapy, working on some neuropathic agents and doing this whole complete treatment of a patient, the last time I saw him, he's walking.
That's amazing.
And G-tube out. He had not had solid food for over a year. God played a major role in this because I'm just a man. And at the end of the day, this took so many hands dealing with him. I will tell you, from people that I've taken care of, that is probably the greatest evolution of functionality that I've seen.
That's amazing. That's what you want to hear. Let's talk about being part of a larger care team here at Boone County Hospital. You've mentioned physical therapy, orthopedic surgeons.
We do coordinate care with primary care providers as well. So there are times where I'll have a conversation with a primary care provider and say, hey, by the way, I think this is going on with the patient. I'm doing this. And there are some things, unfortunately, that we find when we're going through this diagnostic phase. Say if we get imaging, and I can tell you that we have had multiple times where we've found cancers, where we've found unintended things, but that could have been contributing to their symptoms. So that does definitely require additional coordination. And really, that's where your primary care provider plays a major role in that. And we work with podiatry as well. And then sometimes people need a ABI, a vascular study, to look at blood flow going into their extremities. Neurology, also, that's another role that we refer people off to, say for nerve conduction studies, or there's maybe not an actual spinal pathology that a surgeon needs to take care of, but maybe they need to be in the care of a neurologist. And, we make referrals as appropriate, rheumatology, etc. I mean, we work with everybody. You have to have a multidisciplinary basket that you can say, oh, okay, this is the problem. I need to send you here.
Sure.
I need to get you landed here.
Talk about this from a community perspective.
I can tell you, if I go to Walmart, I can't go through Walmart without seeing at least one person. So it makes my shopping trips much longer. But no, ultimately, I feel like anybody in healthcare that is invested in their community is going to try and make a difference within their community, not just in taking care of people, but also just giving back what God blesses them with.
What would you say that you find most fulfilling about your work in pain management?
Probably the most fulfilling thing for me is when I tell somebody that we'll just have you follow up on an as-needed basis. We've done our job, especially if they come in initially really suffering. At the end of the day, we want to try and alleviate suffering. That's really what I'm trying to do. And so from that perspective, that's incredibly rewarding to me to have people that have had maybe a light bulb turn on and they're starting to take control of their lives. That's a huge incentive to do what we do.
Are there any upcoming developments or goals that you're particularly excited about?
We've had some expansion here within the hospitals. We had a third exam room, and we actually got a decent sized office now, which is amazing. We can actually move around a little bit, which is lovely. I feel like we have a pretty good service line that we can offer. And I still have so many people that come in that have lived in this community that are like, oh, I didn't even know we had a pain clinic. Yeah. And so, we've done a great job with word of mouth, and I feel that is going to be a significant growth line for us. If we can work on getting people for more buy-in, for functionality and physical modalities of treatment, overall, you're going to improve the wellness of your community. Yeah. And I think that's important.
To close us out, what advice would you give to someone living with chronic pain who isn't sure where to turn or what to do next?
What I would advise, pain is kind of your body's way of saying, you know what, you need to check this out, right? At the end of the day, I think people need to understand too that just because you come in to be evaluated does not mean you're going to be poked, does not mean you're going to be pushed in any direction. I think if you talk with patients that I've cared for, you would find that they often say, after I've gone through assessing them, going through their imaging with them, going through all the things, I tell people, these are our options. We can do option 1, option 2, option 3, etc. And ultimately, it's your body. You get to choose. Putting it back on that person to be empowered to say, I control this situation. I think that's so important for people to understand that they have control of their lives. Our staff here are amazing, from nursing staff to radiology. Damien's a great guy too. Everybody is motivated for good reasons to take care of people within their community, and that's the kind of people that we have here.
Chris, thanks so much for joining us today and for the compassionate skilled care you bring to our community. If listeners want to learn more about pain management services at Boone County Hospital, they can visit www.boonehospital.com/services/pain-services or call 515-433-8760.
Yep, and I will add Go Big Red.
Thank you for tuning into Healthy Talk. Be sure to subscribe wherever you get your podcasts and share this episode with someone you care about. Until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.